Let's start again now I've put my microphone on. Welcome everyone to this session on supporting someone through cancer. We're delighted to welcome Sian Robinson from Macmillan Cancer Support and also Janos Suter, who works for the Department of Health and Social Care and is representing the Working Through Cancer Network, and he's going to talk a little bit about his story. So I'm just going to take you through a couple of introductory slides. Just a bit of housekeeping for this morning. So if you have questions for our speakers during the session, please use the Q&A function to submit those questions. The chat will be disabled for this session. So you'll see when you write a question that there is an option to post as anonymous if you prefer to do that rather than having your name seen. When we ask questions at the end, we won't mention your name anyway, but obviously if you don't want your name seen, you can press anonymous. We will get to as many questions as we can during the time at the end of the session. We'll just see how much time we have. If you wish to use closed captions, these are available to your personal view. And in order to access these, if you look at the top of your screen where you've got more and the three little dots above it, if you click on there, you'll find out how to do that. So I'm just going to show you a very final slide. This takes you, if you wish to scan this QR code, it will take you to the feedback form for today. We're really keen to get the feedback from these sessions that we've put together for Carers Week. You know, we've given quite a lot of thought to the different sessions and what we think would benefit our civil service caring community, but we really want to hear from you and to learn from you about how helpful it's been. Tina's working in the background on this session, and she will put the link to the feedback form in a couple of times as well, so you don't need to worry about that too much. Just to say finally that there will be slides available from this session, and you can email me to access those. Again, Tina will put my email address in the chat. So I'm going to stop sharing now. And I'm going to introduce it. I'm going to welcome Janos to the platform. Janos is going to talk about his experiences. Where are you, Janos? I want to bring you on. There we are. There we are. So I'll leave you to it.
Great. Thank you, Kath. Yes, so my name's Janos, and I'm a civil servant in the Department of Health and Social Care, working on ambulances and A&E. But I'm also a co-chair of the Working Through Cancer Staff Network here, and involved, again, cross-government with the wider Working Through Cancer Network. And I think cancer is one of those things that obviously affects those people who've been diagnosed with cancer, but the Working Through Cancer networks are very much about supporting everyone affected by cancer, whether that is that personal diagnosis or that of a loved one. And so I'm really pleased to be here to talk about my experiences as a carer, some of the difficulties that I faced, and the support that I had available. So for me, it was my partner, Philippa, who was diagnosed in 2020 with stage 3 breast cancer. So this is not terminal, which is good news, but it was quite bad. It was 90 millimeters and a lot of lymph node affected. And 2020 was a difficult time. So that was during the pandemic, and it was pre-vaccines. But the initial part of it all was I was incredibly busy. I was there sorting out logistics. I was booking appointments. I was stocking up on medicines. I was bringing comfort foods. I was a shoulder to cry on. I Googled like you wouldn't believe. But I think one of the hardest things, well, I was also the deliverer of news, mostly bad news, to save Philippa the stress and pain of telling this story to numerous people. So basically, after each test result, I would phone the family and phone the friends, update them, and sort of answer those factual questions about what was going on, and then hand over the phone to Pippa. And this took a huge toll on me, and I didn't realise how much at the time. And even now, it feels self-indulgent and somewhat selfish of me to be telling my story. And I actually feel a bit guilty about this because, I'm not the one who was diagnosed with cancer. And this is, of course, nonsense, right? So, it was a terrible time for me, and it sort of, the memories, are coming back. But I think it's right to seek help and seek support as a carer. And I think one of the challenging things for me is, I mean, we've been going out for 26 years now, so 20 odd years at the time. But you end up with having, all of our friends in common. We've known the same people, we've known and so actually it was quite hard for me to go to support because these people obviously, very worried about Pippa. And so actually, it was my manager at the time who gave me some excellent advice, which is that you need to fit your own oxygen mask before helping others, and you also need to have a safety net. And so it was, that was excellent advice. And so he encouraged me to seek formal support and counselling, which I did. Not immediately, but again, Macmillan were fantastic, and also the Maggie Centre at Pippa's Hospital, where again, that was something because during pre-COVID or during COVID, I wasn't allowed in during chemotherapy or radiotherapy. And so she would disappear off, and I would sort of sit there and feel sad and have a bit of a cry and a cup of tea, and then be big and brave at the end of it. And so I think really, I mean, for me, I was very lucky to have the support of my boss and my team. And I do feel lucky to work in an environment where I could just take an afternoon off to support Pippa or to digest bad news or whatever it was. And I think, I went to all of her hospital appointments, so well over 50. And, I think she really, well, I know she really appreciated my support. And so I'm sort of coming to the end, I guess, of my story. She's currently symptom-free, doing very, very well, 6 years on. But I think it is still one of those things that still has lasting memories. And I think that's one of the things about cancer in particular, is that you have that initial diagnosis, that treatment, and so on. But there are those longer term effects, and it's something that does stay with you both mentally and indeed physically, with some symptoms, that do continue. And so really, I think my sort of message to everyone who is out on the call or perhaps affected by similar sort of things is that, yes, it is terrible for the person who has that diagnosis, but also again that impact ripples out, and so it's you have the those terrible events do affect not just that person, but their immediate circle and the circle beyond that and the circle beyond that. And it's really important to acknowledge that, both for ourselves but also for those of others, and make sure that we are looking out for ourselves as well as each other, and getting that support and help available. So that's my story. Really happy to answer questions and about what worked for me and others. But I think I'll now hand over to Sian, who will hopefully talk a bit about that support that is available and that is out there. Thank you.
Thanks, Janos. Really appreciate that. I will share my slides. So hopefully you can see them. I'm sharing myself.
Don't have them yet.
No problem. There we go. That looks a bit better. Are they visible now?
Oh, yes.
Yeah, lovely. Super. So thanks very much for having me here this morning. My name's Sian Robinson Brown. I've been here at Macmillan for coming up on 10 years. My first role was as an advisor on the support line, which I did for 6 years, and then I've now moved into being a service knowledge specialist, which is a fancy way of saying making sure the information that our advisors on the phones and web chats and emails give is as accurate as possible, and I also train our new starters. So and we have ongoing training as well. So just bear with me a moment so I can see my notes. Always helpful. So in terms of cancer and carers, I presume that most of you on this call are carers or know people who are caring for people, whether that be in terms of a cancer diagnosis, another long-term health condition. If you're a carer, you are you're one of an estimated 5.8 million carers who are in the UK, unpaid carers, and caring will probably look a bit different for all of you. You may be caring for someone a few hours a week. It may be continual care that you're balancing alongside your work, essentially doing 2 full-time jobs. I know it can certainly feel like it sometimes. So that might be coordinating medical appointments, it might be taking people to hospital, going to collect prescriptions, bathing, feeding, housework. As I say, everybody's experience is different, but everybody's experience is valid as well. So there's a lot of, oh, I'm just doing what anybody would do. Caring is such an important role, and it's one that mustn't be taken for granted. It can be so hard to be a carer as well, because it can be thrust upon you with no preparation, no support sometimes, and that's a supremely difficult situation to be in. As Janos mentioned as well, the psychological impact and physical impact as well of being a carer is something that shouldn't be ignored either, and it's important to bear in mind whether you're an employer or an employee, a friend or a relative. So what I wanted to do first of all was to just visit some of the concerns that we hear on the Macmillan support line about from carers, really, before it vanishes. So we have people coming through to us on a daily basis. We hear from a lot of carers, a lot of relatives, a lot of friends, and the first thing I thought of when it's been a pesky thing today, when I heard when I was planning this session, the thing that jumped into my head was I'm just, and it's one of my pet hates, so I'm just doing what anybody would do. I'll just keep flicking back to this slide, apologies. I'm just doing what anybody would do. I'm just the daughter, I'm just the neighbour. I don't think that just is the sort of language that carers deserve, because whilst you may think you're only doing this and you're just doing that, it's so important to the person that you're caring for. So we speak to anybody on the Macmillan support line, and that includes, oh, it's getting annoying now. I'll just stop sharing for just a moment, just to stop it from flicking around, but I'll talk through the slide instead. We happy to speak to anybody, so carers included. We hear from people when people are going into hospital for tests, or when somebody's aware that something's not quite right, all the way through to after somebody has hopefully recovered from their cancer diagnosis, has had treatment many years ago. We still hear from the people who have cared for them on our support line, and that's people are more than welcome to do that. We don't have any rules about, oh, well, you're not the person with the cancer diagnosis, so we can't talk to you. The next quote I've put on my jumpy slide is, it's not me I'm ringing about. People who care very quickly tell us that when they come through on our contacts, and that's fine, that's absolutely fine. But what we will do is we make sure that we ask everybody who does speak to us how they're doing, and I think sometimes that comes as a surprise to carers, because sometimes you haven't been asked how you're doing. It's all about the other person. So we're a safe space to be able to talk about how you are doing yourself and what support you need and what is concerning you at the moment. Another concern we have is about people, the person who you're caring for, needing support but not wanting to accept that support, and that's a really tricky situation. So when you can very clearly see that, you know, potentially adaptations in the home or a district nurse or that sort of thing is needed, but or even speaking to somebody is needed, but they won't reach out, we can very often talk about that with people. Other concerns range from, I don't know what's going on because I can't get into, I'm not allowed, either not allowed or they don't want me in the appointments with them. There's a lot of complex information that's been passed on to the cancer patient, the person who has the cancer, and they can't remember it when they come out, or they can't remember the detail. That's something that we quite often hear from carers. We hear about queries about how to register as a carer. So registering isn't necessarily something you need to formally do. There is no sort of, unfortunately, no sort of list where Macmillan is automatically informed when somebody becomes a carer or somebody's diagnosed. But that being said, making sure the people around you know that you're caring is always a good idea. So your employer is definitely an important one. Your GP, so that they know that you've got that additional pressure. The local council, who might be able to undertake a carers assessment for you. The Department for Work and Pensions can all be important places to make sure that know that you are caring for your loved one. And another one that I have on here, I'll reshare my slides because it doesn't matter if they jump onto the next one just now. I shouldn't feel guilty, angry, out of my depth. Who says? There's a lot of internal pressure that comes with being a carer, and you're fine to feel like that. That's completely valid. That's very, very common, and that's something that we hold space for on the support line. So if you come to us and you admit to us that you're feeling angry about the situation, that's fine. We're not going to cut you off or anything like that. We'll talk through those feelings and why that is, and what support may be available for you to hopefully make you feel less like that, and also to know that you can come back to us as you need in order to talk things through. So we'll hope the slides aren't going to jump again. They seem to behave themselves that time. I'll just talk about who we are on the support line. Sometimes ringing something like a support line such as Macmillan, or reaching out to other support Maggies that Janos mentioned before, can be quite intimidating. We have people who come through to us saying, oh, I've been worrying about making this call for weeks and weeks. I wish I'd done it sooner. So we have 3 main teams on our support line which you can call for free. I have to caveat that most landlines and mobiles allow you to make a call to an 0808 number for free. There are exceptions, but they're very rare. And we're open 8 a.m. till 8 p.m. every day of the year. So that's your bank holidays as well. So Christmas Day can always be a wobbly time, as can you know, your other big holidays and things, but we're there every day. So we have a team of cancer information and support advisors. That's the team that I work with. We are here predominantly for emotional support and to offer practical information as well. So we will just listen. I've said on the last slide about just. We will listen and we will allow you to tell us whatever you want to talk to us about. We can offer signposting and direction depending on what it is that you're needing to speak about. There's a lot of pressure that comes that people ring with, that they're carrying on their shoulders in general when we talk to carers. So it can be that space that to talk about what you can't talk to the person you're caring about. You maybe can't talk to those around you without them worrying that you're worried, that sort of thing. And we can offer that space. The next team that we have are cancer information nurse specialists. What they do is they're all qualified nurses, as the name suggests, but they don't have access to NHS records, so we work independently of the NHS. So whilst they can't say, oh yes, I can see on your notes that X, Y and Z, we can talk in general terms about treatments, about investigations, about end of life and conversations around, confident conversations around that. Sometimes people don't know who to turn to if the person they're caring for is maybe end of life, and there are questions around what that looks like practically. Our nurses can gently guide people through that. They can simplify complex medical jargon and so forth as well. All of our teams are contactable via web chat and email if you're not a phone talker as well. And we finally have money advisors. You'll notice that their opening times are slightly different. They're open 8 till 6 Monday to Friday, excluding bank holidays. But what they can do is they can talk you through the more financial side of things in terms of benefits. So we often have carers coming to us in terms of maybe on a new diagnosis, a new award of disability benefits, which can unlock benefit entitlements for you as a carer as well, potentially. If a carer needs a break, they can advise on how long you can have a break for, in terms of it potentially affecting your benefits. If the person you're caring for goes into hospital or home care, how that might affect benefits. Earnings and pensions traps, so they can advise people who assume that they're because they're earning or they're over pension age, they can't get carer specific help from the benefits system. So they can check on that. You'll see my eyes flick towards the other screen because I'm not a money advisor, so I had to check my notes on that one. And then we have our information. So we've got a huge range of information that is available however you want to access that. So our booklets are a really, really good resource to know about. We have cancer specific titles that you may well find useful. So you've got a couple of them on screen there. So looking after someone with cancer, it's quite a chunky one, looking after cancer, and working while caring for someone with cancer as well. But we also appreciate that other conditions and cancer can exist alongside each other. So we have booklets about cancer and dementia and how the interplay of those two conditions works. And the communication side of things. Communication could be so difficult during a cancer diagnosis. Either you've previously been able to say anything to the person that you're caring for, and as soon as you have a diagnosis, those open communication channels just seem to dry up. So we've got Talking to Someone with Cancer, Cancer in Relationships as a booklet as well, and some more practical titles as well. So Looking After Someone with Cancer That's on Screen, and that's got space to write down questions for your healthcare, the person you're caring for's healthcare team. Going Home from Hospital, which has I really like that book. It's got like a almost like a blank telephone book, where you can write down the contacts of everybody who might be involved in a discharge plan. So you can make these booklets your own, scribble all over them, tear pages out to take with you to appointments, all that sort of thing. It's and they're free of charge to send out. We send them as well in plain brown envelopes, so they're not sort of unlike my background, they're not plastered with Macmillan Cancer Support. The next information I'll move on to is our online community. Our online community can be found on the top ribbon of our Macmillan Cancer Support website, and it's an amazing resource. It means that you can get contact from support from peers, so other people who are in a caring situation, and they understand like absolutely nobody else will. So you have blogs and forums on this online community. Examples of our forums: Supporting Someone with Incurable Cancer, if that's an applicable one. We have a carers only forum, family and friends forum, Parents of Children with Cancer forum, and blogs such as the one that's on screen here. So Caring for a Partner with a Brain Tumour is one example of many blogs that other users have found it useful to write to help them through their situation, and in the hope that they will help other people going through a similar circumstance. There's one that's called I'm Fine. How do you really cope as a carer, which is really good. All of these can be accessed without having to register for the online community. You're very welcome to register as a member in the online community, which gives you a bit more access, which is also free, but you're very welcome to just observe from afar if you wish as well. Moving on to our website. Our website is vast, but it has a really helpful search function at the top, which I would recommend using, and you'll be able to find a huge depth of information on there, which can vary from taking a break from caring, respite care. There is information about work and cancer, which is really helpful. So understanding work rights as a carer, rights at work and self-employment and cancer, those sorts of things are readily available on there. It's worth having a search and a look if you have anything that's a niggle and you're just thinking, do you know what, I've never really thought to delve into what information there might be. Use this as your excuse to have a look. We're easy. We've got high quality, reliable information. So we have a PIF tick, patient information, and I always forget what the F is, but it's only given to resources that have really clear, really reliable information. It avoids Dr. Google. Dr. Google is I would say the worst. we try to get people to avoid using Dr. Google. AI is the new worst because it just comes up with what it wants to come up with. And just a final one on our information. Accessibility is really important as far as our resources go. So we have easy read booklets. I adore the easy read booklets. Instead of being quite small, they are A4 sized and they have super clear information with really good illustrations in there. So they're available to order as well, either through us or through our website. We can produce Braille large print information as well as information in other languages as well. So we have 16 community languages that we have a stock amount of information that is readily available. If somebody needs another language producing, we can produce limited amounts, so a couple of pages of a booklet, that sort of thing. And we have interactive PDFs as well, and videos for which are BSL enabled as well. So I'm coming to the end of my I would say, I was going to say spiel, but that sounds a bit too silly. But the Macmillan support line information is here on the screen. I'll leave that number up for a couple of a minute or so. Where, as I say, we're open 7 days, 8 till 8. And if you or somebody you know is potentially wanting to reach out to us but a bit cautious, potentially because of either not wanting to talk on the phone, as I say, we've got the web chat and the email side of things, but we also have an interpreter service and British Sign Language as well. So I don't want that to be a barrier to people either. And the online community is there at the bottom. And that's me done. So I shall stop sharing just now. Thank you very much for listening. Looking forward to answering your questions.
Oh, thank you both so much for your time this morning. Janos, I think it was really very powerful to listen to your personal story, and certainly there's been lots of lovely comments in the chat about that. And so interesting as well, Sian, to hear the breadth of the work that Macmillan does, the wide range of it. We've got lots of questions. I just wonder, Janos, I thank you for putting the contacts for the Working Through Cancer Network in the chat. I wonder if perhaps, to start with, you could just say a little bit about what the network, I mean, obviously you've said that a lot of departments have them as well, but what the Working Through Cancer Network does.
Yeah, absolutely. So it was set up by the fantastic Shona Webb, originally in the Home Office, who she'd just been promoted to the SES. On her first day, she realised that she had a cancer diagnosis or received a cancer diagnosis and took time off. But then on returning to work, she found that people didn't make eye contact with her. She used to have brilliant hair. She now does, but she was obviously lost it all, and people didn't really know how to approach it. So she wrote a blog on the Home Office intranet and received hundreds and hundreds of responses, and so then set up the first network in the Home Office, and since then it's spread. So in DHSC, we're a relatively small department of about 3,000 people, but we have a monthly coffee session where it's virtual, so it's online, and people get on and we talk about our own experiences. And it's one of those things where actually, unless you've been through it yourself, it's very hard to have those conversations, and so that's there. But we also, Irina and I, who's my fellow co-chair, we also have one-to-ones with people, but we also get in touch. We support line managers as well, because a lot of line managers They want to do the right thing, but actually they don't know what's, quotes, allowed or so on. And so it's things like, obviously, cancer is recognised as I say obviously, it's not obvious, I think, to many, but cancer is a protected characteristic under the Equalities Act. And so things like reasonable adjustment, people going off on disability leave and so on. So we provide a lot of support in that way. And there are also specialist groups as well. So we're part of that cross-government network, but there's a stage 4 network. There's sort of sub-forums for people maybe whose children have been diagnosed, or maybe they've been diagnosed and want to have a conversation with their children. And so we facilitate some buddying arrangements as well, which can be really helpful, so that people have that sort of support as well. But yeah, lots of support out there on a semi-formal basis, and we can also advocate. And as I say, I feel really lucky to work for an employer which is very sympathetic to these sort of things. It's just a question that sometimes people feel they need permission, and we can help and support in that way.
Yeah, I mean, I remember signposting somebody to the network and who benefited from a buddy, and I think that was great, really great support for that person. It's interesting, actually, you mentioned about children. There is a question somewhere on here which I can't find at the moment, but this might be a question for both of you about information or advice on how to support children where there's a parent that's been diagnosed and is currently receiving treatment. Maybe Sian, would you like to?
Yeah, absolutely. I'll start off. Yeah. We have some information at Macmillan, certainly about talking to children. One of our booklets, we've got a few booklets, in fact, depending on at what stage of some people like the cancer journey as a phrase, and some people don't, but I'll use it in this instance, depending on where the person who has been diagnosed is in their cancer journey. So we find that the initial conversation is so difficult, but the thing to remember is you're the expert when it comes to your own children. So and not worrying about the conversation being too perfect as well. Conversations never are perfect if you think about it. So this is no different. But I would suggest reaching out to the support line, and they will be able to guide you through it, whether that be through sending out the booklets to you, directing you to the website, having that conversation with you about concerns, specific concerns around that conversation that you may have. Comfort is an important thing, making sure you do it sort of in a situation where everybody's comfortable. So are you going to do that at home? Are you going to do that at somewhere where everybody's relatively comfortable and happy, and be prepared not to know everything as well. You can always come back later with answers.
But if you want to add anything to that, Yanis, at all.
Just to say that again, if you're in the civil service, again, we can help in sort of perhaps setting up a buddy or something like that, something so you can again have that talk to someone who's either gone through the same thing or been through that. But
that's a lovely idea.
Yeah. Okay, I suspect that might be the answer in terms of your response, Yanis. It might be quite the answer for quite a lot of the questions. Okay, I've got somebody here who's struggling to find information on who they can ask for help. She's saying it's difficult to organise, or he is saying it's difficult to organise support for their mother when the mother doesn't want it, and it feels like that they will only accept help from that person, and it's exhausting. Yeah, that person is struggling to find information about who they can ask for help from. I don't know if there's anything.
I think letting what you can do is you can let the person you're caring for's GP know that they're being cared for by you. That in itself, if you've got the same GP, that's convenient as well, because your GP knowing that you're under that pressure is important as well. But that can mean that there is potentially additional support that could come from potential check-ins from the surgery and that sort of thing. I think talking to charities who are specific to caring as well can be helpful. So the Carers Trust and Carers UK are brilliant resources as well, in the sense that they specifically focus on the caring side of things. It can be so difficult to, like you say, when the trust is there with the person who's caring. No, I don't want anybody else. And it can be almost small steps in a way. So a kind of like potentially getting somebody else in to visit whilst you're there. Potentially it won't necessarily work in every situation, but those sort of small steps might be helpful. An incomplete answer, I know.
Thank you. There's another one that's very specifically for Sian here, which is, I don't know anything about this, but I'll just read out the question. Is the separation of the nurse specialist from the NHS deliberate, or would you or they ever consider joining up to provide more bespoke advice over the phone?
Ooh, that's a good question. I would say there's no plans at the moment that I'm aware of, just because we've always functioned that way. But there are a variety of Macmillan nurses across the board. So you will find our nurses on the support line who have all worked in the NHS. And it can be frustrating that we can't see the information, but then it can give another level in that we are independent from that and sort of not invested in the NHS side. You do get cancer nurse specialists who will generally be the ones who are with you in the hospital. So they're commonly with people when they get diagnosed. They may have a lanyard around their neck that says Macmillan. We've funded their training, and then as soon as they are trained, they are employees of the NHS. And you also get some Macmillan nurses in palliative care teams as well. And they do the same role as any nurse in a palliative care team would do, Macmillan branded or not. So I don't think there's any plans to change how things work.
I'll just come in with a sort of personal experience, and obviously anything I say is just me, not a departmental view. But I found it hugely, or we found it hugely helpful. I sort of remember back to those initial diagnoses and treatments and so on, and you'd have that sort of quite hard clinical room where you'd see the doctor or the radiologist or whatever, and then afterwards you'd go into the crying room with the comfy chairs and the tissues and the Macmillan nurses, and you'd sort of digest it as well. And I thought that, well, working well is perhaps not the right phrase, but you know, given the circumstances, but it seemed to work for us anyway, I think. So yeah, just a personal view.
I mean, that's really helpful to hear from somebody that's actually been through it as well. We've got a couple of questions about whether there are people in their family who have terminal cancer. One here says, my sister is terminal, and we've got a difficult, estranged relationship, living separately, and they want to be there as much as possible, but it's really hard to navigate family dynamics. Tentative about asking for details as she's very private, and the struggle of being there from a distance when they're not asking for help and would, you know, and wanting to be there if help is needed. And then there's another one. I'm just putting those together if I can find the other one quickly. Yeah, any tips on how you cope mentally with a terminal cancer diagnosis of a loved one? Our mum has stage 4 breast cancer. Thank you for sharing, by the way, people in this meeting. These are really, really difficult situations that you're talking about. Yeah, the mum was doing well, but has recently started to deteriorate and going from being positive one day to being in such pain that she just wants to sleep forever. You know, and So there's something about coping mentally with that, and I guess that's part of what was there with the other question as well, and how you can tell whether someone has just got weeks or months or years left.
Such difficult difficult situations, both of them. Certainly supporting from afar is a really tricky thing, especially if it's in an estranged relationship, because you've got the relationship dynamic on top of the cancer diagnosis as well. Was that a sister, did you say? Sorry. Yeah. I didn't want to get the relation wrong. I think making sure that you're looking after yourself in both situations is key. Janos mentioned about the looking after yourself before you look after somebody else. I think you can't underestimate the impact that being in either of those situations has on you. So making sure that you're not losing touch with what it is that you find helpful to keep yourself in a good position. So that might be, thinking about what's worked in the past for you to help you to remain calm, to remain, or even not to remain calm, to feel the feelings. Feeling the feelings is so important. So if you are, I'm rubbish at it. It's very much a do as I say, not as I do sort of thing. But making sure that if you are feeling particularly bereft on a particular day, whether that's you or mum really, and not knowing about how sister feels, what is it that will help you in that moment? Is that talking to somebody else about it? Is that is that going for a walk? Is that staring at a wall? It can help sometimes. Making sure that you're okay first, and then moving on to how you can support that other person. So in terms of the estrangement, it might be a being prepared to being told no, but reaching out in a way that helps you to feel, do you know what, I've done my bit, not done my bit, but I've checked, sort of thing. It's a very imprecise science though, and mum, the thing, everything changing from day to day is so difficult, because you'll of course think, oh, maybe we've made a bit of a breakthrough now, and the day after is appalling in terms of the pain and the discomfort and that sort of thing. But I would say making sure that the people around you know what's going on as well. So do the people who are nearest and dearest to you know how difficult it is for you, and know that things do vary, and know that one day is never the same as the next.
Yeah, and I wanted to just pick up, there was a comment in the chat about someone whose mum is unwell, and their dad is too worried to leave them alone, and struggling to encourage him to get help because he's not the one that's ill, which was perhaps I felt at the start of this process. And I think my advice will be there is that maybe there's something about saying, what support does he need in order to support your mum even better or even more? So there's a lot of help and support out there, and so actually maybe there is something about trying to help dad see that by using this support, he can provide even more support to mum, and in doing so, hopefully his own needs will get picked up. And as Sian said, that question, and how are you? And occasionally people will say that, and then they'll just burst into tears or whatever, and that can be the sort of point at which they realise as well. So that would be my advice to that question, which I think is similar, or related to what you were saying, Sian, there.
Yeah. Oh, you're on mute, Kath.
Sorry, I was going to come to that question, so I'm really glad that you addressed it anyway. I mean, it's occurred to me in some of these answers that this kind of the cancer within the relationship can then cause quite a lot of struggles within the relationship in terms of who's supporting who, and am I okay to ask for help and those kind of things, or difficulties in relationships, like with the comment about the sister. I'm only saying that because our next session today at 12 o'clock is challenging relationships when caring. So, you know, if you are finding that the caring responsibilities are creating challenge within your relationships, or that you're caring and there is an existing challenge, that session might be helpful for you as well. Let's move up the slides. Okay, this is I will go through this one quickly. It might be a bit niche, but any advice for anyone supporting someone with cancer who's actually living in another country, particularly with regards to balancing caring partners and work when there's international travel? My mother has cancer, and to give my father a break, I'm in my home country 10 days a month to care for her. But it never feels enough. Gosh, that's a big commitment, isn't it?
That is a huge commitment. Absolutely.
Don't know if
That's
there's anything
fair.
I can really.
I would make sure if you well, I'm assuming being in this webinar, there's employment involved. I started off my career at Macmillan as an information support advisor. I moved on to our now non-existent work support team. So with my work support team head on, I would make sure that you have access to all of your policies, your work policies and things like that, so that you know that you've got the most support that you can do. Obviously a very supportive employer, and that side of things I would double check, but that must be exhausting. It must be absolutely exhausting. There is, I'll see if I can dig it out and put it in the chat. There is a resource that we refer to, which is cancer support information charities across the world. So I'll see if I can dig that out, because it might be that the wherever you're traveling to may have a sort of equivalent of Macmillan, which might be able to support. So I shall make a note of that.
Yeah, and I would just add, be kind to yourself. I mean, it's really hard, and you do feel guilty about, you know, that you're not doing enough, or you can't do enough, or whatever. And you're just in a, you know, it's a really crappy position to be in, and it's awful. So, you know, I think there is something about just yeah, be kind to yourself, look after yourself.
Definitely.
I mean, so many questions in here about challenges of coping with loved ones who have cancer diagnosis. Somebody said, "I'm so grateful for the session today. It felt extremely helpful and a little weight off my shoulder. Would love to access the Macmillan line, though we do have a number to our hospital specialist, but they aren't always able to answer the call. So it's good to know there's a direct line." Next is that up to husband going through future treatments. I'm also grateful to the network and to know the support is there. So I think that's really a kind of a comment of appreciation for both the supports that are
The network
available.
just seems amazing. I'm really impressed. It just seems such a lovely space.
Oh, I'm sorry, Janos, you were going to say something. Okay. I mean, somebody has put, so touching to see how many people are sharing their personal experiences, sending love to everyone in the session. And I think that that's, you know, we do really appreciate people, and, you know, we may not get to them all because there are so many. I think for those of you that are talking about really struggling with your own mental health and well-being, the charity does have a well-being service where we can arrange a well-being conversation and then look at signposting, potentially sorting out some support for you. You know, maybe counselling or something like that as well. There's somebody here saying, as a 10-year cancer survivor, I'm so fortunate to still be here. This person had lots of support from Macmillan, or lots of information from Macmillan was very useful in putting them at ease, and knowing that they weren't alone. Yes, and Also, she said, I'm sure my husband had time away whilst I was having chemo, just a meal out with his mates at the pub, time for him to switch off. Finding that balance is really important, which I think is what we've kind of been emphasising throughout this, taking those times when you can. What's this? My father's been diagnosed with stage 4 cancer, and we've been discharged because he's not eligible for treatment due to existing health issues and his frailty. Would we still be expected to have a CNS? I don't know what CNS is.
Clinical nurse specialist.
Yes.
I'm
like
not.
We've been discharged and lost to it.
I'm not sure what the answer is, but I can take that away and come back via you, Kath, maybe?
That would be helpful. The person that's asked that question, you've asked it as anonymous. If you email me, because you may not want to give your name in this chat, if you email me, my email is in the chat. It's kath.shear@cfcs.org.uk. If you email me directly, and then if Charlotte emails me with a response, then we can get that to you. We've just got another 5 minutes.
Can I just pick up one that I saw, which was just about from Isabel about sort of supporting some friends far away. So I think it's sort of it can be hard, and there is a bit of that. You get some news, and then you sort of like phoning around a circle of people, and it's not so much the time, but it is quite difficult, and so sometimes you do want just a bit of quiet time, and I think that's understandable. But I would say we got lots of little presents, so flowers or someone who's now known as Champagne Kath because she sent us a bottle of champagne, which was great. But the most touching one was some homemade brownies from my nephew. So something like that, but with no expectation of so I'm just remembering it now. But I think one of those little acts of kindness I think would go that. And you can always say no need to reply or no need to respond, but I'm here if you need to talk.
Thank you. And there is one, I think, Janos, that is probably still really about kind of options in work. The person talking about exhausting themselves because they're using their annual leave and their flex predominantly for their mum's medical appointments. And, it seems like there's no other option than unpaid carers leave or reducing hours. But are there any other options really in a work context?
And it's very hard without getting into specifics, but I think that is where I will be encouraging them to sit down with their manager and say, look, actually, we're in this really difficult situation, and work through the options. There is compassionate leave. There are, as an employer, we are very flexible about these sort of things. So it would be. I think it's about sitting down and having that conversation with your line manager, and maybe getting someone from the network to come along with you and talking to them about what your options might be. It's a bit sad, but we do find that there is variety and different approaches and a bit of unwarranted variation in approaches on that. And
indeed, I think on this one, Janos, where they've said that they've been refused by they've made requests and it's been refused by the current manager and their manager, and they've checked with HR as well. So like you say, it's very tricky, isn't it? Because there is a little bit of variation sometimes.
It's hard, and it really does depend on the individual and the amount of time on that. But I would be getting in touch with the network and see if there are options on that.
Yeah, I think that's a really great offer actually, to get in touch with the network, because then you will be talking to other people who have been through those situations. So it's 10:59. This has been a great session, and loads of time for questions, which I think has really brought it to life for everybody, and a difficult subject to talk about, a difficult thing to go through. And, you know, thank you to all the people that have contributed. I'm sorry if we haven't got to your questions. If as Tina has put in, if you want copies of the slides, predominantly about Macmillan, you can email me on kath.shear@cfcs.org.uk. The contacts for the cross-government carers network are in the chat. Maybe Janos, you could maybe pop them in again, because obviously things, or maybe Tina will have put them in, just because things slip down the chat, don't they? So but yes, thank you so much. We really appreciate your time this morning, and yeah, we'll see you again, hopefully at other sessions. And don't forget to reach out to the charity if that's important. So thank you very much, everyone.
And thank you, Kath, for hosting us all and
Thank you.
giving us this opportunity. Thank you.
You're very welcome. It's been good. It's been really great.
Thanks, everyone.